mainly relevant for non-communicable chronic lifestyle-based diseases and not the acute conditions or infections or accidents or like that. So what is the nature of the heart disease? So if we see in a society or at any clinic, most doctor visits are for the lifestyle-based diseases, which are the non-communicable disease. And heart disease is a lifestyle-based disease, which means that it is a largely preventable disease and largely reversible disease also if approached appropriately through lifestyle intervention. If we look back just 50 years ago, this epidemic of metabolic syndrome, obesity, hypertension, prediabetes, diabetes was not there. Within just 50 years, heart disease has become #1 reason we and most of our loved ones will die of. So this pandemic of chronic diseases is ascribed mainly to the universal shift toward a diet which is dominated by animal source and processed foods like meat and dairy products, junk foods, egg, sugar and refined grains. With modern medical revolution, we are living longer, but we are living sicker. We are actually living fewer healthy years than our ancestors did. So, when is this heart disease starting within us? When is this fatty streak which is appearing in the heart vessels? Which is the age and how is it progressing to a full-blown plaque? If we trust researchers, studies of accidental death victims between ages of 3 and 26 years found that fatty streaks, the first stage of atherosclerosis, was found in nearly all American children by the age of 10. So, and looking at our westernization of our society, this finding holds equally true for us also. So with same lifestyle, by the time we reach our 20s and 30s, these fatty streaks can turn into full-blown plaques, and by the time we are 40 or 50, they can start killing us. And this picture of 40 and 50 years old people having ischemic heart disease, this picture we are seeing in day-to-day life in our clinical practice of cardiology, in OPDs and IPDs. So question before us is not only prevention of the heart disease, but reversing of the heart disease, which is already started within us. So this is about the nature of the heart disease I want to talk about. So let us look at the next question, whether this heart disease is reversible. The answer is yes. Lifestyle medicine pioneers such as Nathan Pritikin, Dean Ornish and Caldwell has shown that healthy enough diet not only stops the disease but also reverses it. So let me share with you what has been called the best secret of the medicine. Given the right conditions, body heals itself. This is the best kept secret of the medicine. And if we keep it re-engineering metabolically every 3 times a day, we interrupt that healing process which body has capability of. So lastly, I will like to comment on the role of the modern medicine in this heart disease, which is starting since early age and is progressing in 40s and 50s, and it is reversible as shown by many researchers. So what is the role of the modern medicine in chronic non-communicable lifestyle-based diseases like heart disease? We fully agree and are convinced that drugs are essential to control the disease once it has happened. But this should be looked upon only as a short term and not as a permanent thing in each case. So as these are lifestyle-based diseases, the true intervention should come from lifestyle intervention and diet changes and not from the drugs every time. Let me give an example. There is a drug known as ranolazine, which is an anti-anginal drug. The highest dose of this drug was able to prolong exercise duration by 33 seconds. So this certainly is not going to help us climb the mountain. So, I mean, the usage of the drug should be seen in the context these diseases are lifestyle based diseases, and the true intervention should come from the lifestyle intervention rather than relying totally on the drugs. Lastly, I want to make one point. We as medical students never had a single course in nutrition. Most of the public considers doctors to be very credible sources of the nutrition information, whereas surveys have found that doctors are not at all trained to counsel patients about their diets. One study had found that people off the street sometimes know more about basic nutrition than their doctors. This stresses the need for introduction of course in nutrition from undergraduate years. This is what I want to say about the heart disease, and the intention of the today's camp should be that we should have the awareness of the disease, and that this disease is coming from inside. This is generated from inside, not from outside. So the intervention should come from inside rather than depending totally on the drug and medical industry. Thanks for listening to my words patiently. Thank you.